Hi there, it's Dr. Jen. Today we're going to talk about screening, and in particular, we're going to talk about the ARIA test, what it means, how to interpret the results, and what to do once you get the results. So first, I just want to review what I think we should be doing for screening because we are on the precipice of greatness. We are right now moving from a very, very toxic, harmful screening system where we're using a test that actually causes cancer to screen for cancer towards using things that are safe, that are painless, that are comfortable, and that can help guide you and maybe even help you to prevent a cancer. So this is why it's so important to know and understand this. So let's first start with my screening paradigm. So I have three things in my screening paradigm. The first is that I think everyone should be doing self-breast examination. It is so important to know what your breasts feel like, to know what your breasts look like, to know what they are when they're normal so that you can recognize a change. Everyone thinks their breasts are lumpy. Absolutely everyone thinks their breasts are lumpy. And it's just important to know your lumps, own your lumps. So you're going to do that breast examination once a month. If you are premenopausal, if you're still getting your cycle, you're going to do that examination 1 week after your cycle. If you are postmenopausal, you're going to do that examination once a month. It doesn't matter when it is. You're going to both look at your breasts in the mirror and you're going to examine your breasts. And that includes the tissue underneath the arm. So the first part of my breast cancer screening paradigm is doing a breast examination. Now, the second part, and what we're going to focus on today, is the ARIA test. So the ARIA test is a test that's done on the fluid in your eye, the tears test, as it's referred to. And what it's looking for is inflammatory proteins, the S100A8 and S100A9 proteins. These are the proteins that are associated with the very early stages of breast cancer. So these are inflammatory proteins. These are created when there is inflammation in the breast, and they're fairly specific to the breast. Yes, there is an outside chance that they could be associated with some inflammation in the gut, but for the most part, these are associated with inflammation in the breast. So if you have a clinically significant result, this means that you have those proteins. This means that you have the inflammatory proteins that are associated with inflammatory conditions in the breast. And you need to do more to figure out what is happening in your breast. So absolutely 100%, if you have a clinically significant result, you need imaging. Now, that is the third part of my screening, is that I use QT for imaging because it's accurate, because it's safe, because it's comfortable. And if you have access to QT, great. But if you have a clinically significant result and you don't have access to QT, you need to go have imaging, even if it's conventional imaging. And I can give you the link to my radiation protection protocol, which can protect you against the harmful effects of radiation so that you can comfortably, in your mind, undergo that workup. It's not going to be comfortable because it's a horrible, torturous test, but it may be a necessary evil because, as I always say, I am not saying that no one ever needs another mammogram. I'm saying no one ever needs another screening mammogram, but diagnostic mammograms are a different story. Now, let's talk about what a clinically significant result means because it's important. If people are going to get this test, they need to understand what the results mean. So this test, the ARIA test, has a sensitivity of 93%. That means that 93% of the time when someone has cancer, it will be detected on the ARIA test. That's what a 93% sensitivity means. It will pick up cancer when it's there 93% of the time. So let's talk about what it's missing. When you have breast cancer, in the very early stages, you will secrete these inflammatory proteins. But in the later stages of breast cancer, these proteins may go away. So the ARIA test may miss a cancer that has progressed more. It may also miss a metastatic cancer. But what it's designed to pick up are the early cancers, are the asymptomatic cancers, are the precancerous conditions so that you can do something about it. So that is what the sensitivity means. It again means that 93% of the time when there's cancer there, it's going to pick it up. That means that it's going to miss 7% of cancers. That is still better, way better than mammogram. Way better than mammogram. Let's talk about what to do with a clinically significant result, because this is really important. We need to be able to understand this test and the power of this test and what to do with the results of this test if it's going to be helpful. So the specificity of this test is 58%. That means that if you have a clinically significant result, 58% of the time there's a cancer there. And so we need to use this information to act. So if you have a clinically significant result, you absolutely positively need to have an examination and get imaging, because 58% of the time there's already going to be a cancer there. Now, that also means that 42% of the time, if you have a clinically significant result, there is no cancer there that you can find, that you can see on imaging, that you can feel. However, you need to understand that if you have a clinically significant result, there is absolutely inflammation in the breast. And even if you are not seeing anything on imaging, you need to know that you have inflammation in the breast and that this is your opportunity. This is your opportunity to do something about it. And what I recommend is that you start to think of it from a functional perspective. Get a copy of my book, The Smart Woman's Guide to Breast Cancer. Look at the causes of breast cancer and try to figure out how they may apply to you. And at the same time, know that you need to think about what you're eating, what you're drinking, how you're thinking, managing your stress, moving your body in a way that is helpful and promotes your health, prioritizing sleep, looking around your environment for all of those toxins that can be hormone disruptors, endocrine disruptors, or can just directly harm your health. And then thinking, are you living in a way that is in agreement with your life's purpose? Are you doing things every single day to be better, to be joyful? Because this is what life is about. And if you are instead creating inflammation, then this is just going to progress. So I hope that you understand what a clinically significant result means now. It means that there is a 58% chance that you have breast cancer. And conversely, there's a 42% chance that you just have the risk factor, which is the inflammation that leads to breast cancer. Either way, this is most likely very early on in the process, and this is your opportunity. This is your opportunity to reclaim your health and live the life that you want to live. It's Dr. Jen. Bye for now.